With the bariatric surgery that we provide, there's 3 procedures: the Roux-en-Y bypass, the sleeve resection, and adjustable gastric band. They vary on weight loss. The most weight, or the procedure that provides the most weight loss and the fastest weight loss, is going to be your Roux-en-Y bypass. And on average, patient will lose about 65 to 75% of their excess weight. On the other end of the spectrum is the adjustable band. Those patients, a good weight loss would be about 50% of their excess weight, and the sleeve will fall in between at about 60% of their excess weight. In regards to mortality for the procedures, the riskiest procedure, or the procedure that has the highest complication possibility, is the Roux-en-Y bypass, and the band is considered the safest procedure amongst the 3, with a sleeve in between. From a overall mortality, if you take all 3 procedures combined, it's anywhere from about half of 1% up to 1% total for all 3 procedures. Obviously, the bypass has a little higher risk for mortality than the band, since it is a more invasive, more complex procedure. The benefits for bariatric surgery address not only the weight loss, but also the other disease processes related to obesity. The 4 big ones being heart disease, high blood pressure, diabetes, and sleep apnea. In regards to those 4 disease processes, we can impact those with the procedures we offer. From a heart function standpoint of heart disease, we're going to improve the contractility of the heart. We're going to help normalize your triglyceride and cholesterol levels, or bring them back towards normal. From a high blood pressure standpoint, 50% of patients will have improvement in their needs for blood pressure medicines, or requirements will be lessened for their blood pressure medicines. In sleep apnea, we will cure about 40% of those patients and have a marked improvement in up to 70% with requiring less settings on their CPAP machines. In regards to diabetes, we'll have an overall improvement. All bariatric surgery procedures combined will improve diabetes in 78% of patients. We will cure diabetes with a Roux-en-Y bypass in 85% of patients, and this relates to adult onset diabetics or type 2 diabetes. The discrepancy between mid-70 range to 85% is we don't see as good a results with diabetes as with a band or the sleeve as we do with the bypass, and that's why that overall number is lower. But 85% of Roux-en-Y gastric bypass patients will have cure from their diabetes. Not only from a bariatric surgery standpoint can we impact the medical conditions related to obesity, but also affect the quality of life for patients by helping them with their weight loss. We can increase their physical activity and their perceptions of their health. We can also increase sexual interest for patients with the weight loss. One study showed that of patients who were morbidly obese on public assistance or disability and who received bariatric surgery as an intervention, half of those patients were able to return to the workforce and contribute to society. So not only is it medical conditions that we're impacting, but also the quality of life and aspects of life that are important for everybody. As we've mentioned, or as we've discussed in this talk, the Roux-en-Y bypass is considered the gold standard of the 3 procedures that we offer here at Mount Carmel. We know that it's a very durable procedure. There's a study based out of the Annals of Surgery, a leading medical or surgical journal, that was published in 1999 that shows that the Roux-en-Y bypass has a durability to its procedure with maintenance of weight loss. And as the study shows, patients even 14 years out from their surgery were able to maintain 50% of their excess weight off by making the proper daily choices, whether it's dietary choices or exercise choices. So it is a durable procedure. In regards to specifically diabetes and bariatric surgery, the study was published in 1995 from from another major surgical journal that looked at the requirements at two groups of patients, one who had surgical intervention for weight loss, the other one who did not, and looked at their requirements for diabetic medications preoperatively and postoperatively, along with the mortality. In patients who received surgery, their diabetic medicine requirements dropped significantly. In those patients who did not pursue surgery, their diabetic medication requirements increased significantly. Up to 85% of patients were requiring medication for diabetes at the end of 5 years. They looked at mortality, and they also showed that the patients who received surgical intervention for weight loss had a much lower mortality at 5 years than those who did not. The discrepancy being about a 10% chance if you had surgery for obesity of not surviving in 5 years, and most of those deaths were related to trauma and cancer. The patients who did not receive surgery had almost a 30% chance of not being alive at 5 years.